Welcome to Mental Healthy, the podcast where we share stories of the professionals and experts worldwide working in the mental health field. Here's your host, Dr. Kenyon Knapp.
Well, welcome everyone to the Mental Healthy Podcast. I'm glad to have you with us here today. I've got a special guest, Trish Kessler. Glad you're here with us.
Thanks so much for inviting me.
Absolutely. Some of you might look at Trish and say, she looks familiar. And the reason why is Trish was kind enough to join us 5 years ago here at Liberty, March 18th of 2019. And she was a speaker at a special convocation we had here on campus. And it was super effective. I know so many people were helped by it. And so we're grateful you're back.
I was very flattered when Lexi emailed me. Appreciate it so much.
Absolutely. Well, we're glad to have you. Some people recognize you, like I said, from that event, but some might not. So give the listeners a little bit of background on yourself, like what kind of work you do and where you live and things like that.
Sure. Yeah, it's a different background, I guess. Trish McCoy Kessler. I'm a licensed professional counselor. I'm also a certified eating disorder specialist and a consultant where I teach other counselors to be eating disorder specialists. And but my background, like I said, is a little different. I have a music bachelor's degree, and I sang and played bass in various rock bands for years, and was a pharmaceutical rep. Did different things until I felt that, hey, I think I know what I want to do when I grow up, and felt the call of what I should be doing.
Yeah.
And went back and got my master's here at Liberty in counseling, and just kind of looking around at what I wanted to specialize in, I felt that there was a huge hole in the market for treating eating disorders, and it was, rising in our community. And so I just learned more and studied and got that specialization and started Empower Counseling, which started in 2016.
Okay.
And at first I just started seeing women and adolescent girls. I just wanted to specialize in that niche.
Yeah.
But then I saw eating disorders, and then the counseling field kind of broadened, and I just wanted to help everybody. And I had a lot of counselor friends who wanted to join the practice, and so now we have about 27 counselors, and we treat everything and above and beyond eating disorders as well. And so very blessed to have all these great people that making a difference in our community.
Well, I knew it had grown, but 27 people, that's quite a crew. That's great.
Yeah, there's some part-time, full-time. I also have 2 telehealth solely counselors and a couple of admin staff, and just a great group of people. Absolutely.
Yeah. Well, that's where you are currently. Let's go back in history just a little bit.
Okay.
This is all great. Give us a feel for why do you want to become a counselor to begin with? I know you said you started out with a vocal performance major, but then what sort of shifted you to saying, hey, being a counselor would be great or something?
Yeah. Well, when I went to get my undergrad, it was either music or sociology.
Okay.
And my mom went for sociology.
Okay.
And so I was like, well, yeah, I want to be a sociologist or counselor of some sort. And I interned in college at the Genesis House, which is no more. It was a home for abused children at the Presbyterian home, now Humankind.
Okay.
And my brother also had a lot of mental health issues. And so I was like, yeah, I want to be a counselor. And I was 18, going to school.
Yeah.
But then I had this bug of music and wanted to play and tour and all of that. So I kind of shifted gears and went and did music. And so, after 15 years or so, I was like, you know what? I think that's really what I should have been doing. And I still wanted to do that. Yeah. My brother passed in 2000 for mental health and alcoholism. And I don't know. I just felt like God was telling me, hey, this is what you were supposed to do all along.
Yeah.
And went back to school, and here I am.
Well, that's cool. I bet a lot of people can relate to that, though, like having, a number of different interests in life. Like you're drawn to counseling, but there's another gift you have or things like that. And it is hard to sort that out. And I guess that's part of the counseling process, too, of figuring out where you need to be in life.
Absolutely, yeah.
That's cool. Well, that's good. That gives the listeners a little bit of background on you and where you come from. Now, I know you mentioned earlier, too, your practice specializes in eating disorders, and you've treated that a lot over the years. Why would you choose to specialize in eating disorders, or what's the demand per se for eating disorders? I mean, some people know, but other people are like, I don't know about that.
Sure. I think for me, like I said, I kind of saw a need in the community that wasn't being filled. I think there was one other counselor,
Yeah.
but there was just a huge need with college students. We have 5
Absolutely.
colleges in the area, and high schools, and me as a musician and performer, I struggled also with some body image and probably did a lot of unhealthy things
Sure.
to be on stage, and so I really understand what.
Yeah.
Young girls and now, guys also what they struggle with body image wise, and the other many, many reasons that people have eating disorders.
Yeah.
And so I kind of get it. So started to, specialize in that. But over the years, I think that it's grown even more, unfortunately. And, earlier we were talking about social media, and I have a love-hate situation with that.
Yeah.
And I just think that there's a lot of young people who are watching, everything on social media, that it can be very influential. And I hear from my own clients that it has been influential in comparing themselves to other people and doing unhealthy things. And so, now we have about 6 people at the practice who specialize in eating disorders. Everybody else, they treat everything and have various other specialties, trauma, grief.
Yeah.
And so I'd never dreamt that it would be that big.
Yeah.
But I to this day, I probably could still hire even more people who want to work with eating disorders because we always have a wait list.
Yeah, that's true. So, I mean, when Trish spoke at the convocation we had here on campus, I was blown away by the interest and the demand for your services then. And I'm, like you said, I'm sure it's only grown since then.
Yeah.
What you're saying about social media too, it sort of matches what my kids tell me. I've got 3 kids in college right now. And I was asking my kids, and of course they're like a lot of the kids their age, very much into Instagram and the other, social media outlets. And I would say to them, well, what is it about this that makes it influential, whatever? And they said exactly what you just said, that comparison. They said that when they go on social media, everyone's putting their best foot forward. Like here we on media right now, but like people get on camera and stuff, and or Instagram or whatever, Facebook for my generation, and we all sort of there's a tendency to like try to look your best,
right?
And like sort of go happy, with all your pictures and stuff, and frankly create a false impression.
100%.
And like try to like make it look like life is perfect all the time, which is just not true. And so I could see how that would affect people. And the research I've read recently is that it affects teenage girls more so than boys or some other demographic groups. And I guess, do you see that in your practice too?
Oh, absolutely. And, it's not just what they're, and I hear this from, the youngest girl that I've treated, Dr. Knapp, is 8.
Oh, wow.
And that's just heartbreaking for me.
Yeah.
But yeah, that's exactly what they see. They see everybody, looking their best. But what I also teach these young girls and teenage guys that we see is that these images aren't really even real. They're photoshopping or doing all these different, I lost my words, but altering all these photos. So that's not even them. That's not even a real photo of them. It's manufactured. And so they're believing something that's, like you said, not even real, which alters their perception of how they're supposed to be, and then comparing them to something that is false. And so it just really gets warped in these young girls' minds, and their rational thought is just challenged.
Yeah, definitely. And I'm sure when people compare themselves and all that, it leads to all kinds of negative mental health outcomes. I know for you, you mentioned you graduated from Liberty, and I know your practice is a Christian counseling practice. How do you use your faith and your past experiences in life to affect your counseling and the way you work with clients?
Empower is we're not a Christian counseling practice solely.
Sure.
And I kind of did it that way. You
Okay.
know, I mean, I'm a Christian. I love to integrate faith into my practice, and so does
Sure.
probably 70% of my counselors there.
Sure.
But I did that because I think if I named myself a Christian counselor, then I would maybe only attract clients that were Christians, and that's wonderful. But I thought that maybe if I attracted, all different types of people, I could still have that influence and bring that, be that role model and still teach them about the Lord if, as the ACA says, if they want that in their practice.
Sure. Yeah.
But I just feel like I've reached so many people, just, being a power counseling and then, asking a patient, hey, is it okay if you want to integrate this? Some people say no, but I would tell you probably 90% of people that I've worked with say absolutely, that helps me in my life. And what I've seen too with, not that people that don't have faith don't have that healing, but I've seen them heal faster, and they have that, they just have that higher power, they have God that's on their side, and that just absolutely helps along with the clinical approach.
Yeah. Yeah. Well, everything you're saying makes sense to me because, some people coming to Liberty or other Christian colleges like focus on being Christian counseling only, but the Apostle Paul said, I become all things to all people that I might win some, and so it seems to fit what you're saying that like we don't have to be Christian counselors all the time. We can just be a counselor, and who incorporates our faith with those that want it, and some don't.
Right.
But you can still help them, and then as you do a great job helping that person, it might create an opening to share what motivates you to be a good counselor.
Absolutely.
Or some not.
or some not.
Yeah.
But, I think just, and then just even being a role model and people, how did you get through, if I disclose, which is rare, but sometimes I do in session.
Yeah.
Well, Trish, how did you get through all of these things that you've been through in your life? And, and then I'm like, well, mainly God. There's no other explanation.
Yeah.
And counseling, of course.
Yeah.
And so they're like, well, wow, really? And so if that's a great way to have my testimony, then I think that's an awesome place to do so.
Yeah, absolutely. Well, we've already talked about Empower Counseling a little bit, and you got 27 people there. And you mentioned you've got 2 people right now who do telemental health.
Yes.
And your practice is large. You're successful in the business. So there's a lot of people listening who are maybe professors or students, and they're debating the pros and the cons of doing telemental health versus traditional face-to-face like this.
Yes.
What would you say are some of the pros and cons of in-person versus telemental health? I guess maybe by what you've seen in your own practice.
Absolutely. I don't know. I tell people that was maybe the one good thing about COVID is it introduced us to reaching more people with telehealth.
Yeah.
And for me, telehealth is okay, but I prefer in-person conversation, connection.
Yeah.
But I still have people that I've seen. I have one girl that I still see 5 years later after COVID or 4 years later. She lives in Northern Virginia, and that situation has worked perfectly for us. And so Sarah Goins, one of our counselors, she used to be in person, and then she moved to North Carolina for various reasons. And she said, hey, Trish, I'd like to work full time, but can I do virtual? I'll get licensed in North Carolina and Virginia.
Yeah.
And I was like, sure, we'll work that out. And she's remained to have a full-time caseload with clients. And then Sandra Noble, she was also on our panel. I think you remember her.
I do.
She teaches at George Fox University in Oregon.
Yeah.
And she said, hey, I still want to work with my Empower clients. How can we work this out? So she does the same. And so that's been a huge blessing for us to reach people, right now in the state of Virginia, especially with eating disorders, because it's such a need that you can't find counselors.
Well, and it's specialized, too. I mean, your average Joe Schmo counselor might not know what you need to know about eating disorders. Yeah.
It's hard to treat eating disorders virtually. At some point, there's a lot of trauma aspect as well. And so I always caution people that, EMDR you can do on telehealth, but I would not recommend it.
Yeah.
And so there's some situations where it's not advantageous, and then we find that right person in their area.
Yeah. Do you ever sort of mix the two, like have like a hybrid version of doing some telemental health, some? How does that work when you do that?
Oh, absolutely. I mean, I would say everybody at the practice has a hybrid mix.
Okay.
And we also offer that, say that, hey, I'm traveling or I'm sick today and I still want my counseling session. Can I switch it to telehealth? Of course. And so it allows us to still see people in certain situations.
Yeah.
Or if I'm sick and I'm like, hey, I'm going to work from home today, then it still works out.
Yeah. When we were talking a second ago about the telemental health and those Sandra Noble and some others who live in other places, I know right now a lot of the students listening, they're really big into the counseling interstate compact system, where you can get licensed in one state but practice in another if you do that privileged practice form in the states and all that. Has that been impacting your practice as well, the interstate compact system, or not as much?
Not yet. I don't think it's really approved for us to do so as of yet. I think they keep pushing that date back.
That's right. That's right.
But I mean, I would love it if that would happen, because we are, especially when we see college students here, we've got 5 in our area, and so, it's hard. Hey, I'm going home for the summer. Well, you live in Massachusetts. It's going to be really hard for me to treat you. We have this great rapport. So that would really help with continuity of care.
Yeah.
With especially college students, I think.
Absolutely. You're right. I'll admit, listeners, I don't keep up on every little state difference laws about where the interstate compact is active yet. And I know it's coming here in Virginia, but I think it's not quite here yet. Right. But you're right. That'll be great when that does happen.
Absolutely.
Because what we need is national licensure, just to make it more simple for us to practice across state lines. And we're so transient as a society these days. Everyone's moving here and there and traveling. And it'd be nice if we could just, if I could go to California for a week and you're my counselor, I could see you from California or whatever. But
absolutely. I mean, during COVID, there were special circumstances where you could do that. And I guess if it's an emergency, I think it's okay. Maybe just not all the time. So
Well, let's dive into a little bit of your specialty area with eating disorders. And I know your practice is well known here in town and well respected for your expertise. Where do you see that field going? Like, where are the new little specialty areas or new little treatments or things like that? Where's it all going?
Well, that's a huge question. It's I think now that men, teenage boys, everybody, struggles with eating disorders. It's not back in the day where it's just teenage girls.
Yeah.
And so learning how to treat everybody, and everybody is so different.
Yeah.
And so for me, I'll use an integrative approach of EMDR, which is for trauma. That's if the patient is refed and is in a good spot, of course.
Sure.
CBT, DBT. And I also use some yoga and somatic therapies, because I think that with eating disorders, what they found is more of an embodied approach helps, because that's the disconnect between your mind and your body. And so putting those together is just so important to treat eating disorders. And so I, as a yoga therapist, I'll use some of that in my practice and really have seen that help. But you have to we're at an outpatient level, and so that's, we have to have our patients in a really good spot to be able to do EMDR, to be able to do a lot of therapies. If not, then we can refer them to a higher level of care. And on the lines of where treatment is going, I think that's really hard, because we've seen some treatment centers shut down, or getting them into a higher level of care is really difficult because of insurance. And so we have to fight a lot to get with our eating disorder clients' care. And they don't take Medicaid, Medicare, and so it's a challenge to get them treatment. It really is.
I've read recently that as far as mortality rates for different mental health struggles, that number 1 in America is overdoses from drugs, and that number 2 is eating disorders. Is that consistent with what you've seen, that it's still probably one of the most if untreated, one of the more fatal conditions?
Absolutely. And a lot of times it's not dying from the eating disorder, but it's from suicide.
Okay.
And, thank goodness I haven't had anybody in that severe of a state. But I have heard of people dying from anorexia. Your body just gives out. You have a massive heart attack.
Yeah.
Or I have some girls who are obsessive over exercisers.
Yeah.
And then if they're not nourished, then we've got the perfect storm there. Or using drugs as well.
Yeah.
But a lot of it is also from suicide just because of the severity of their mental health and physical state.
Yeah.
And just feel hopeless and helpless.
Yeah. That makes sense. I mean, because I know for a lot of people I've known who struggle with eating disorders, I have the opposite problem, by the way. But people
enjoy food; it's great.
I do. Well, I do too much, but the people I've known, they've said exactly what you're saying, that the struggle with depression is really bad because they feel like they can't beat it per se. That it's sort of this lingering struggle, and feel like that some of them feel like they never get past it, or. Well, it's hard to get past.
You're
it,
right.
I guess. Yeah.
You're right. I mean, unfortunately, I've worked with some women. They've been to treatment 7 times, and it's a lifelong illness, and so they do feel helpless and hopeless. That hey, this is never going to stop.
Yeah.
And it is heartbreaking.
Yeah.
But we just try to instill as much hope as possible.
Yeah.
But also with the brain fog, I think what eating disorders do to your brain function and cognitive just impaired.
Yeah.
That you just don't think rationally or, and so that's why maybe their brain goes to, I don't want to be here, and they don't have that rational thought to stop, self-harm or things like that. I mean, some people also say, anorexia or certain eating disorders is also a form of self-harm.
Mm-hmm.
Think about it that way too. So
that makes sense.
Yeah.
Well, let me ask you this. You mentioned you use yoga with your practice. I've heard some people say before that having like some kind of a holistic approach to the client helps. I've heard some people say that some practices have like nutritionists and things like that. What are your thoughts about like having a holistic approach to a person in treating this issue?
I think that's great. Actually, and that's what we do at Empower is we do have a dietitian on staff as well. And she's an eating disorder specialist also.
Oh, perfect.
Yeah. And so we do like to treat the whole person. I think if you just sit down and say, all right, we're going to use CBT and reduce these cognitive distortions, that's just half of the battle.
Yeah.
I think treating the whole person, mind, body, spirit, helps long-term goals. And so I do yoga myself, and then I first got certified in restorative yoga, which is more or less mindfulness and relaxation.
Yeah.
And that's kind of what I use with clients too. I don't use any power yoga, no vinyasa, nothing like that. Just something to get them so that they can sit with themselves. Yeah. And a lot of mindfulness and stretching can release some trauma and tension and connect your mind and your body.
Yeah.
And I absolutely think treating the whole person is, just long-term healing, I think.
Okay. Well, that makes sense. You were actually just touching on my next question about what treatment approaches you use. What are your thoughts on that? Like, I mean, I know there's certain ones you might prefer yourself, but what does the research show, and what do people in your practice use that seems to be most effective? Because there's probably somebody listening going, hey, I'd love to work with this field, but I don't know, what should I study in college that's going to really help me?
I think the standard, of course, is CBT, cognitive behavioral therapy. I think that's what they really teach us in school, and that works wonders. Yeah. But then there's a lot of times where, people need EMDR, which is eye movement, EMDR, desensitization, reprocessing. Yeah. And, which is for trauma, but we use EMDR for many other things besides trauma. Of course, eating disorders, anxiety, depression, OCD. Yeah. And what that does is it really helps rewire how you think about yourself in a certain situation. And so I think EMDR is great, but we have to be very careful with treating eating disorders with that, because if there's a trauma background, then we don't want them going back to their old coping skill, which is using the eating disorder.
Yeah.
But I would say DBT, I like a person-centered approach as well. And some DBT also if we have a borderline client, I think.
Dialectical behavior therapy.
You got it.
Okay.
Thank you for saying that for me.
Yeah.
But I think that is, the gold standard for borderline personality, and that works really well with eating disorders and BPD together. And so, I don't know, sometimes I'll just find myself just toggling in between or whatever resonates best for them. Helps.
Well, that's encouraging to hear because, we've got a decent-sized counseling program here at Liberty, and a lot of the ones that we theories we teach and all are the things you mentioned, but of course EMDR is a postmaster's certification you get.
Correct.
And we don't really, we'll have a class on that here and there, but we don't really do that whole training. So, but that's encouraging to hear. You mentioned yoga a second ago. Let me ask you, how do you incorporate yoga into the treatment process?
Yeah, mainly it's more of a mindfulness. I've got this one client who I adore, grown woman, and she has trauma, eating disorder, and various other things that she struggled with. And one of the things that we've been working on is how do you sit with yourself? Because a lot of times with eating disorders, they don't want to think about things. They don't want to think about what's going on or happening to them. And so really sitting there and being present and mindful is so hard for people. It's hard for me. I mean, and so even when I'm doing yoga, my mind is everywhere. And I'm like, whoa, stop, Trish. Just be here in the moment. Enjoy your practice. And so that's one of the main things that I use it for is mindfulness.
Being comfortable in your own body at the moment?
Absolutely. Okay. Yeah. And with, the body image issues that people have and just body, not really acceptance, but body neutrality and just kind of letting them sit with themselves and sometimes feeling sadness is okay. A lot of times we want to push that away but it's okay to sit with yourself for a second and kind of ride the wave, as we say, and work through it.
Yeah.
And yoga really helps well with that.
Yeah, that makes sense. I guess you really have to reach a point where you accept yourself. Like, this is my body and good and bad and whatever, it is what it is.
Yeah, it's very difficult, yes.
Yeah.
Absolutely.
That's cool. You touched on something, too. I want to be mindful of time, too. So I'll always wrap up and ask people a final question about sort of a catch-all question at the end. So we'll get to that. But I want to ask you, too, you mentioned sometimes people need a higher standard level of care. Yes. And you've got a private practice situation. What are some places you would recommend? Like if someone's listening and they go, hey, I know a client right now who really needs more than a private practice. Absolutely. What are some of the better places you refer to?
Yeah, that's something that I actually love to do is kind of be a liaison and help people if they need a higher level of care.
Yeah.
Around here, there's not many places, but the closest place for residential. Well, let me go through the different levels of care.
Yeah, please.
So we're at an outpatient level. Empower Counseling is OP, and then the next level is IOP, which is an intensive outpatient. And usually that's 3 days a week that someone can get care. Okay. In the eating disorder field, they'll have a dinner together and then a group in between. And then there's PHP, which is partial hospitalization program, which is, you go to there all day long, maybe 8 to 3.
Okay.
There's a lot of virtual programs for that as well now.
Okay.
And then the next step up from PHP is residential, where you send someone and they stay there maybe 30, 60, 90 days.
Okay.
To really stay there, to get renourished, to get therapy, medication if needed. And then above that is inpatient, when someone is not medically stable and they really need to go get that medical stability. Yeah. Maybe tube fed, but I really hope not. But that has happened.
Yeah.
And so first is figuring out what level of care does this person need.
Yeah.
And a lot of that takes, lab. We do lab work. Of course, I can't order labs, but I have doctors that we work with.
Sure.
That order labs, make sure where they are within that, medical stability. But to answer your question, as far as around here, I like Astor Springs, which is in Richmond, Virginia. They're part of the Odyssey Network.
Okay.
But they only take women.
Okay.
They have 2 houses there. They have a residential, and then they have a cottage on site where patients can step down once they successfully finish residential and go to PHP and then IOP.
Okay.
So that's one. If you want a faith-based program, there's Selah House in Indiana.
Okay.
There's also a free program in Tennessee called Mercy Multiplied, which
Okay.
is also a faith-based program. For teenagers, there's some good programs. There's Veritas Collaborative, and they have programs in Durham or Atlanta. Adolescents, there's also Clementine.
Okay.
And then it kind of spreads on throughout the nation with Eating Recovery Center or Acute Health. I mean, there's a lot of them, but unfortunately, a lot of our patients have to travel and go far away, and that's really hard, especially if you're a teenager. But
Sure.
But it does work.
What about, you mentioned some of the places only treat women.
Yes.
What if somebody's listening and they go, I've got a male client with an eating disorder and he needs a higher level of care. Are there any places you'd recommend for male clients?
Absolutely. Veritas,
Okay.
they take males as well, teenage guys. Carolina House, and I think they're in Durham as well. They accept males. And most places are,
Okay.
gender inclusive,
Yeah.
and so you would just have to call and make sure, or the websites are really great, or if someone has a question, you can reach out to me.
Okay.
I have a lot of their patient reps, for various treatment centers, and they can help out. And I kind of love doing that, kind of helping people get linked to the right place.
Sure. Well, let's go there specifically then. If people are listening and they go, wow, this lady knows all about it, I need to ask her more.
I don't know about all that, but
Well, how would you like people to contact you if they have follow-up questions?
Sure. Absolutely email me. It's trish@empowercounseling.info.
Okay.
And reach out, ask me a question. Be glad to help you in any way.
Great. And then your private practice is Empower Counseling. Do you have a website with that?
We do, empowercounseling.info.
Okay. Empowercounseling.info.
When you go to the website, you can see all of our counselors, read their bios, see our dietitian and all of her certifications. We also, I forgot to mention too, we have a nurse practitioner there now.
Okay, great.
Who prescribes medications, and Crystal is awesome. She's there part-time, and so love to have that wraparound services in one place.
Absolutely, because I'm sure there's medical issues a lot of times, so that's great. Well, let me ask you this. I always try to wrap up. I have a list of questions I try to discuss with you, but there's always something I left out. As you think about all that we've talked about today, what are some final thoughts you might want to leave with the listeners about maybe something I haven't asked you about yet?
Yeah. Well, I think just final thoughts.
Yeah.
I wouldn't want people to ever be afraid of going to a counselor. I see a counselor. It helps, all the time. I think there's still some people that are very timid about going to see a counselor. No offense, maybe men.
Yeah, no, it's true. We fit the bill.
Yeah, and so I just would encourage people, hey, it's not that you have to have a serious mental health problem, but it's okay to just for life transitions or career help, or just to have someone to hear you and to validate you and to be there. And we have a great team, of course, at Empower Counseling, and but there's a lot of great practices in Lynchburg too that have really great people. They do great work, and so that's the one thing to take away. And if you can always incorporate your faith too in your healing, I always think that's just so much better, and I couldn't live without it.
Yeah, that's how most of us cope when things get rough.
Sure, absolutely.
Makes sense. Great. Well, thank you for being with us today. I really appreciate it. Yeah.
Good to see you 5 years later.
Yeah. Well, and do you do? She did a great job, by the way, when she spoke at Convocation here at Liberty.
Thank you.
Do you ever travel and speak at different places?
I do. Yeah, I've spoken at colleges, sororities, different company things. I've got a list of my speaking topics on our website under my page.
Okay.
Anything from substance abuse to college stress to entrepreneurship, opening a practice, or women's success. And so would love to speak if needed.
Great. Well, I can confirm she's a great public speaker.
Thank you.
So, I encourage you folks listening, if you want to have a great speaker about these topics, you've got one right here. So
Thank you so much.
thanks for joining me today.
Absolutely.
And thank you, listeners, for joining us today as well. We really appreciate you being with us here today. And we look forward to you joining us next time here on the Mental Healthy Podcast. So thanks so much. Bye-bye.
Thanks for listening to this episode of Mental Healthy. If you want to hear more episodes, please hit the subscribe button wherever you get your podcasts and head to linktree.com/mentalhealthypodcast for all of our social media platforms with the latest mental healthy content. If you have a story to share that relates to what we discussed in this episode or any other episode, please contact us at mentalhealthy2020@gmail.com. That's mentalhealthy2020@gmail.com. Thank you, and God bless.